The Black Plague, also known as the Black Death, devastated Europe in the 14th century, killing an estimated 25 million people, or about 1/3 of the continent's population. After the recent events of COVID-19, I looked into similarities between coronavirus and the Black Plague. While they are completely different in nature and effects, they are both infectious diseases that impacted the global population. In this video, we will look at the Black Plague or the bubonic plague and try to apply modern knowledge to understand how medieval societies could have mitigated the disease. This catastrophic epidemic, caused by the bacterium Yersinia pestis, had profound social, economic, and cultural impacts. While medieval society lacked the scientific knowledge and infrastructure to combat such a virulent disease effectively, there are several theoretical measures, based on modern understanding of infectious diseases, that could have significantly curtailed its spread. One of the critical steps in stopping the Black Plague would have been recognizing and understanding the nature of the disease. The plague was primarily spread through fleas carried by rats, but also through human-to-human transmission via respiratory droplets in its pneumonic form. Early identification of the disease's vectors and modes of transmission could have led to more effective containment measures. Enforcing strict quarantine measures for affected individuals and areas could have greatly reduced the spread. The concept of quarantine was rudimentarily practiced in some places, such as the Venetian controlled ports where ships were isolated for 40 days. Expanding and enforcing such measures rigorously across Europe could have limited the spread. Since the disease was largely spread by fleas carried by black rats, a comprehensive rodent control program could have been instrumental. Medieval societies could have focused on sanitation improvements to reduce rat populations, such as better storage of food and waste management, and using natural predators like cats. Another critical factor would have been the advancement and dissemination of medical and public health knowledge. Although this is an anachronistic suggestion given the period, if medieval Europe had access to even rudimentary germ theory and basic epidemiological practices, the response could have been vastly different. Improving public health infrastructure by promoting better hygiene and sanitation practices would have been crucial. This includes the use of cleaner water sources, better waste disposal systems, and encouraging personal hygiene habits among the population. Establishing hospitals or infirmaries dedicated to isolating and treating plague patients separately from the general population would have helped. Ensuring that healthcare workers used primitive protective measures, such as masks and gloves, could have also mitigated the risk of transmission. The role of governments and communities in managing the crisis cannot be overstated. A coordinated response from local and national authorities, supported by the church and other influential bodies, would have been necessary for effective control. Disseminating accurate information about the disease and its prevention would have been essential. Using town criers, church services, and written notices to educate people about the importance of quarantine, hygiene, and avoiding areas with high infection rates could have significantly altered the public's behavior. Providing economic support to those affected by quarantine and to families who lost their primary breadwinners could have lessened the resistance to public health measures. Additionally, ensuring that food and essential supplies were available to quarantined populations would have prevented people from breaking quarantine out of necessity. While vaccination was not a feasible option in the medieval period due to the lack of medical knowledge and technology, it's worth noting that modern understanding underscores the importance of vaccines in preventing the spread of infectious diseases. If a vaccine had been available, a widespread immunization campaign would have been the most effective measure to stop the plague. In conclusion, while the medieval period lacked the scientific understanding and infrastructure to effectively combat the Black Plague, theoretical measures based on modern epidemiology could have significantly mitigated its impact. Quarantine and isolation, rodent control, improved hygiene and sanitation, public education, and governmental support were all potential strategies that could have been employed. The tragic experience of the Black Death underscores the importance of disease prevention and preparedness lessons that are still relevant in the face of modern medicine. If you enjoyed the video, please consider liking and subscribing to the History Forum YouTube channel.